Last month, I met with a group of folks here in my office from the South Central Kentucky Drug Task Force. They spoke with me in depth about the drug epidemic in Kentucky, which, like many states, is it's a serious issue. The Kentucky State ONCDP director was present at this meeting, and he agreed with the notion that the drugs that are destroying our communities are coming from Mexico. And that is why we must secure the border. And if we can't get agreement from the other party on securing the border, then I support the President's measures to declare a national emergency, because we have a terrible drug epidemic. It seems like in the rural areas, which in districts like mine is pretty much the entire district, the drug problem gets worse every day. It's not getting any better. According to the CDC, Kentucky, along with over a dozen other states, were labeled as having a statistically significant drug overdose death rate increase from 2016 to 2017. Kentucky had an 11% increase from 2016 to 2017. Drug overdoses killed 1,566 people from my state in 2017, 170 deaths in my district alone. And between 2013 and 2017, fentanyl seizures by the Kentucky State Police have risen by more than 14,000%, and that's not a typo. At the same time, meth seizures have increased by 299%. The fact of the matter is that deadly drugs continue to pour across our border and into our communities, including the vast majority of cocaine and heroin consumed in America. What occurs at the border touches even the smallest rural communities that you will never hear about. That's why I care so strongly about what happens at our borders with regards to illicit drugs coming across, and that's why I remain committed to securing our borders from dangerous crime and drugs that are killing our people. Director Carroll, how does the ONDCP utilize law enforcement partnerships across federal, state, and local entities to address illicit drug trafficking?
Thank you, Congressman. First off, I want to thank all the efforts that are taking place in Kentucky. I'm going there next week, actually, and I'll be meeting with some of the representatives at DHL, where so many drugs are coming through from China that way.
In northern Kentucky, UPS, and in Louisville, right?
So your constituents down there working at those facilities are really trying hard. In terms of an understanding of the ports of entry, and maybe to answer your question about between the ports of entry, in the last 2 years, the amount of fentanyl that DHS has seized between the ports of entry has increased over 468%. Between the ports of entry, just talking about fentanyl. The partnership that we're able to utilize with our friends at HIDA, working at the federal, state, local, and tribal level, are able to come together, provide us, as Director McDaniel said, real-time, instant data of exactly what's happening. I'm on the phone frequently, usually on cell phone, and a lot of times in the evening, with our HIDA directors across the country, finding out firsthand. I don't want there to be a filter between, the law enforcement folks, the treatment folks, anyone, who are able to reach out and touch. I know Community Anti-Drug Coalition is here in the audience, CADCA, and I'm constantly on the phone with them in the evening. And so getting real-time data, regardless of the issues that we're concerned about, is key to working with our law enforcement partners, including U.S. Coast Guard.
Quickly, how does the ONDCP leverage its relationships with international partnerships with other countries, such as Mexico, to disrupt the flow of illicit drugs?
We work very closely with and I work very closely with our foreign partners. In Colombia, we've been talking about cocaine. They have a new president, President Duque, as you know. I've already met with him 4 times since he took office last fall, including 2 weeks ago when he was meeting with President Trump, and I participated that. In China, as we talked about with Chairman Cummings, I'm heading to China again in April, and frequent conversations with our U.S. ambassador to China, as well as the Chinese ambassador to the U.S., pushing them on class scheduling of fentanyl. Mexico is certainly a challenge, and we're working hard through an ONDCP-led effort of the North American Drug Dialogue.